In the action of rotating your head from side to side, I'm going to discuss the muscles that are used. The sternocleidomastoid is used to rotate the head. It's innervated by the accessory nerve of the same side. It also functions in moving the head down and like laterally moving the head to opposite sides. Its origin is the sternum and its insertion is the mastoid process. The scalene muscles also assist in rotating the head from side to side. It's innervated by the cervical spinal nerve, and it also assists in flexing and laterally bending the neck from side to side as well. Its origin is the posterior trabeculae, and its insertion is your second rib. The spinalis cervicis also assists in rotating the head from side to side. It's innervated by the medial branches of the spinal nerve, and it also assists in laterally flexing the head from side to side and bilaterally extending the vertebral column. Its origin is the spinous process of the seventh cervical, and its insertion is the spinous process of your axis. The semispinalis capitis also assists in rotating the head, and it's innervated by the cervical spinal nerves. It also assists in helping your head stay in an upright position, and when one muscle isn't acting as strongly as it should, it assists in the rotation, basically in a circular motion. Its origin is the cervical and thoracic regions, and its insertion is the occipital bone. The oblique capitis inferior also assists in rotating the atlas, which helps rotate your head. It's innervated by the suboccipital nerve and the first spinal nerve. It also plays a key role in keeping the head in an upright position. Its origin is the atlas bone, and its insertion is the inferior nuchal line on the occipital bone. The trapezius, it's innervated by the cranial nerves. It obviously helps in rotating the head from side to side, and it's also used to tilt the head and neck and to shrug or steady your shoulders. In the action of opening and closing your mouth, I'm going to discuss some of the muscles used. So the masseter muscle is the key muscle that pulls the mandible upward. It's innervated by the trigeminal nerve, and its origin is the maxillary bone in the zygomatic arch, and it's also the deep and medial surface of the zygomatic arch. Its insertion is the ramus of the mandible. The lateral pterygoid helps open the mouth, and it's innervated by the lateral pterygoid. It also assists in depressing the mandible, and its origin is the outer surface of the lateral pterygoid plate, and its insertion is the pterygoid fovea. The temporalis assists in closing the mouth, and it's innervated by the temporal nerves. It's also assisting in chewing and biting food, which is basically closing your mouth, and its origin is the temporal fossa and the deep part of the temporal fascia. Its insertion is the coronoid process of the mandible. The medial pterygoid helps close the mouth as well, and it's innervated by the trigeminal nerve. It also helps move the temporal mandibular joint, and it elevates the mandible and moves it forward. Its origin is the medial side of the lateral pterygoid plate, and its insertion is the ramus of the mandible. The digastric helps open the mouth as well, and it's innervated by the facial nerve, and it also helps elevate the hyoid bone, which helps the movement of substances down the throat. Its origin is the mastoid process, and its insertion is the hyoid bone.
The action of the deltoid anterior is flexion and medial rotation of the humerus at the shoulder. The origin is the clavicle, and the insertion is the deltoid tuberosity of the humerus. The action of the deltoid middle is the abducts of the humerus at the shoulder joint, and the acromion is the origin, with the insertion of the deltoid tuberosity of humerus. The action of the deltoid posterior is the extension and lateral rotation of the humerus at the shoulder joint. The origin is the scapular spine, and the insertion is the deltoid tuberosity of the humerus. They all have the same nerve supply, which is the axillary nerve roots C5 and C6. The action of the pectoralis major is flexion, adduction, and medial rotation of the humerus at the shoulder joint. The origin is the sternum to rib 7, medial half of the clavicle. The insertion is the intertubercular groove of the humerus. The nerve supply is the lateral pectoral nerve and medial pectoral nerve clavicular head C5 and C6, sternocostal head C7, C8, and T1. The action of the bicep femoris is it extends the hip, flexes the knee, and laterally rotates the leg. The origin of the bicep femoris is the long head, which is the ischial tuberosity, and the short head, which is the posterior midshaft of the femur. The insertion is the head of the fibula. The nerve supply for the bicep femoris is the fibular branch of the sciatic nerve L5 and S2, and the long head innervated by the tibial branch of the sciatic nerve L5 and S2. The action of the vastus lateralis, it extends the knee. The origin is the greater trochanter lateral lip of the linea aspera. The insertion is the tibial tuberosity and patella. The action of the vastus medialis also extends the knee. The origin is the intertrochantic line medial lip of the linea aspera. It also has the insertion of the tibial tuberosity and patella. The action of the vastus intermedius also extends the knee with the origin of the anterior shaft of the femur. It also has the insertion of the tibial tuberosity and the patella. The nerve supply of the vastus lateralis, medialis, and intermedius is innervated by the muscular branches of the femoral nerve L2, L3, and L4.
In the action of bending over, the gluteus maximus, which is innervated by the inferior gluteal nerve, assists in this, as well as assisting in a lateral movement of the hip and the thigh. This down a little bit. Its origin is the ilium, and its insertion is the gluteal tuberosity of the femur. The hamstrings also assist in this, such as the semitendinous, semimembranous, and the biceps femoris. They also assist in flexing the knee and extending the hip. Their origin is the ischial tuberosity, and their insertion is the tibia and the fibula. The intercostal muscles, which are innervated by the intercostal nerve, assist in extension and rotation of your trunk, and their origin is ribs 1 through 11, and their insertion is rib 2 through 12. The piriforms, which also assist in the bending over, are innervated by the sacral plexus, and they also help to rotate and abduct the thigh and the hip. Their origin is the greater sciatic notch, and their insertion is the greater trochanter, or like the upper part of the tibia. Your external obliques, which are the most external ones, are innervated by the subcostal and the thoracoabdominal nerves. They help pull the chest downward, as well as compressing the abdominal cavity. Their origin is the lateral ribs 5 through 12, and their insertion is the linea alba of the abdomen. Your internal obliques, which sit just below them, are innervated by the lower intercostal nerves. They help support the abdominal wall and help rotate the trunk. Their origin is the lumbar fascia, and their insertion is the costo region. The rectus abdominis muscle, which is like the abdomen, the abs, are innervated by the subcostal nerves. They assist in pulling the rib and pelvis in and curving the back. They're used for coughing, and they also flex and turn the spine. Their origin is the superior pelvis bone or pubis bone, and their insertion is the costal cartilage. The soleus, which is back here, is innervated by the tibial nerve. It helps in plantar flexing of the foot, such as this. And its origin is the sacral line of the fibula, and its insertion is the tendon calcaneus, or the Achilles tendon. Your gracilis is innervated by your obturator nerve, and it helps in hip abduction. Its origin is the ischiopubic ramus, and its insertion is the upper medial shaft of the tibia. Your gastrocnemius, which is right outside your soleus, is innervated by your tibial nerve, and it assists in plantar flexing of the foot as well. Its origin is the lateral condyle of the femur, and its insertion is tendon calcaneus, or your Achilles tendon as well. Your adductor magnus is innervated by your obturator and your sciatic nerve. It also contracts and pulls the hip towards the body midline, so this motion, and it also extends the hip, so the opposite. Its origin is the ischiatic ramus, and its insertion is the abductor tubercle. The action of the crunch uses multiple muscles, such as the rectus abdominis muscle, which is innervated by the subcostal nerve. It also pulls the rib and pelvis in and curves the back, which helps a lot in crunches. It's also used for coughing, and it flexes the torso and spine. Its origin is the superior end of the pubis bone, and its insertion is the inferior edges of the costal cartilage. The external oblique, which also assists in crunches, it's innervated at the subcostal nerve and at the thoracoabdominal nerve. It helps pull the chest downward, and which compresses the abdominal cavity. Its origin is the lateral ribs, and its insertion is the linea alba of the abdomen. The internal obliques, which are just below the external obliques, are innervated by the lower intercostal nerve. It also supports the abdominal nerve, or the abdominal wall, and it helps rotate your trunk as well. Its origin is the lumbar fascia, and its insertion is the costal margin. The transverse abdominis, which is just below the internal obliques, it's supplied by the lower intercostal nerves as well. It also helps stabilize the lower back and the pelvis before movement. Its origin is the inner lip of the iliac crest, and its insertion is the pubic crest and the xiphoid process. The iliopsoas are innervated by the femoral nerve. They also are the strongest flexors of your hip, which also assist in crunches. Its origin is the ilium in the lumbar vertebrae, and its insertion is the lesser trochanter of your femur. The rectus femoris, which is a muscle in your leg, it actually helps assist in extending or raising the knee, as well as crunches, because in the good crunch position, your knees are upright. Its origin is the anterior inferior iliac spine of the pelvis, and its insertion is the patellar tendon. The tensor fasciae lata, it's innervated by the superior gluteal nerve, and it helps abduct and medially rotate your femur muscles, so it's assists in hip flexing. Its origin is the iliac crest, and its insertion is the iliotibial tract. The sartorius, which is another muscle in your leg, is also innervated by the femoral nerve, and it is a rotator of the thigh at the hip joint. So it assists in this sort of muscle, and it also assists in giving you a good crunch position. Its origin is the pelvic bone, and its insertion is the anserinus.
In this video, I'll be going over the lower legs. I'll be talking about the muscles with their insertion, origin, action, and nerve supply. The first one I'll be going over would be the gluteus medius, which is located at the hip, actually. It is right here. And the origin for this would be between anterior and posterior gluteal lines, lateral surface of the ilium. The insertion would be by the short tendon into the lateral aspects of the greater trochanter of the femur. The action would be to abduct and medially rotate the thigh. Abduct, and then rotate the thigh. This steadies the pelvis, which is important for walking. And the nerve supply would be the superior gluteal nerve. The next muscle I'm going to be going over will also be located in the hip, but in the back of the hip, really. This muscle will be gluteus maximus, which is located right here. This will cover up the gluteus medius, and then the origin for this would be dorsal ilium, sacrum, and coccyx. The insertion would be gluteal tuberosity of the femur, The action would be major extension of the thigh. And this helps with running and climbing. It laterally rotates and abducts the thigh as well. And the nerve for this would be inferior gluteal nerve. The next muscle I'll be going over will be in the lower legs. And I'll be going over the tibialis anterior, which is located right here. It'll be in the front of the leg. And the origin for this would be lateral condyle and upper 2/3 of the tibial shaft. The insertion would be by a tendon into the inferior surface of the medial cuneiform and first metatarsal bone. The prime action for this would be prime mover of dorsiflexion. So dorsiflexion. And then this is to also help with inverts the foot. And the nerve supply for this would be deep fibular nerve. The next muscle I'm going to be going over will be the extensor digitorum longus. The origin for this would be lateral condyle of the tibia, approximately around 3/4 of the fibula. The insertion would be middle and distal phalanges of the 2nd to 5th toes. And the action for this is the prime mover of toe extension. I'm not sure if you guys can see it through my socks, but it's supposed to separate your toes. And dorsiflexion of the foot as well. And the nerve for this would be deep fibular nerve. The last group I'll be going over of muscles would be in the foot. The next muscle I'll be going over would be flexor digitorum brevis, and it's located in the middle of the foot, but it'll be underneath, really, like right here. The origin for this would be calcaneal tuberosity. The insertion would be middle phalanx of 2nd to 4th toes. The action is to help flex toes, so flexing of the toes. And then the nerve supply would be medial plantar nerve. And then the last muscle would be abductor hallucis. I'm sorry about that. The last muscle would be abductor hallucis, which is on the side of the foot next to the big toe. And the origin for this would be calcaneal tuberosity and flexor reticulum. The insertion would be proximal of the phalange of the great toe, middle side, and the tendon of flexor hallucis brevis. The action would be abduct great toe. I'm not sure if you guys can see this or not, but that's what it's doing, abducting of the great toe. And then the nerve supply for this would be medial plantar nerve as well. And those are the muscles of the lower leg. And yes.